Mike, off you go. We're live everywhere.
Well, good morning, everybody. Great that you could join us. We're really pleased to see you here. I'm Mike Morrissey. I'm Chief Executive of the European Cancer Organization, and we're going to have what we hope is a dynamic conversation with our panel today and with all of you on the big question for today's agenda, which is, has the Beating Cancer Plan met our great expectations? A year ago, many of us were in the European Parliament with Ursula von der Leyen and Stella Kyriakides for that inspiring launch of the consultation on the plan. Many of us involved in this call and many of you participating have been involved in that consultation. It's been a huge effort to that consultation. And now last week, we got the results. Now, what do we think of it? What do we like about it? What's missing from it? And is it ever going to happen? How can we be sure that it's going to be delivered? They're the questions we're going to be asking today. You can contribute to this debate by using the Q&A box at the bottom of your screen. Please keep your questions and comments coming, and we'll try and bring them into as much of the conversation as we can. And we've got a great panel. We've got 3 MEPs from different political groupings. Somebody told me that you 3 are known as the 3 musketeers in healthcare. Is that really right? I can't believe it. But anyway, Tomislav Sokol, Niku Stefanuta, and Sarah Curtis, they're here with us. They're leaders in the healthcare issues in the European Parliament. We'll be hearing from them. And we've got with us patient advocates, a leading oncologist from Croatia, and 2 colleagues from DG Santé who helped put all of this together. So we've got a great panel. We're looking forward to all of your questions and comments and your contribution. But let's start off by hearing from Tomislav, who put this initiative together. Tomislav, over to you.
Mike, thank you very much for this great introduction. And I would first definitely like to thank our panelists, Sarah and Niku, and the others, obviously, the Professor Vrdoljak, Mr. Belina, Thea and Caroline, and Antonella. So I think we have a great panel. So we've been able to combine all the relevant stakeholders, so the Parliament, the Commission, patient organizations, policymakers. So I think this is a great team that can really highlight all of the aspects of the Beating Cancer Plan. And of course, I would also like to thank all the attendees for joining us and for listening to us today. So first, yes, this has been, I would say, a historic occasion, the publication of the Beating Cancer Plan, because I think this is the really first document produced by the Commission, which kind of presupposes a very holistic and systematic approach to healthcare issues. We know that traditionally healthcare is primarily a national competence, and those pieces of EU legislations or actions were really ad hoc. They were always kind of reactions to some pressing need that has occurred in a short or middle term. So this is, I think, the first time that we actually have a holistic, systematic plan, which does not answer to only particular problems which we have now, but also has a vision of looking into the future. So how to resolve all of the problems related to cancer, but also into the direction how to streamline future initiatives, how to stream both European and national policies on how to beat cancer. And this is what I wanted to say. And this is why this Beating Cancer Plan is a big step forward. What the added value is, and this is connected to what I just said previously, is the fact that it is the first plan which is really holistic. So it doesn't really only focus on the treatment, which is always typically the most talked about issue about healthcare in general. So it's about treatment of a certain disease or condition, but that this plan is much more holistic. So it covers everything from prevention, early detection, screening, treatment, and what is also very important, aftercare and afterlife of cancer survivors. And I think this is a real novelty. This is a real added value of the plan. And this is something that needs to be definitely recognized. Of course, there are many important issues mentioned there apart from this general holistic approach. Of course, the cancer registries, that's something new. The exchange of data, a lot of provisions of exchange of data, which is a really big issue related to when you try to coordinate healthcare policies in different member states. And also, what is even more important is always funding. So we have a precise figure of 4 billion euros, which should be spent on the implementation of this cancer plan, beating cancer plan directly. But I think apart from this direct investment, I think that also additional funds will be invested. So I don't think this will stop here, because we also, apart from the EU for Health program, which is now 12 times bigger than it was in the previous 7 years. So this is also a big achievement also for the European Parliament, who was able to fight for this and make this happen. That also cohesion policy funds and Horizon will play an important role in terms of investing into health infrastructure, into health research, and that is very important. One additional aspect, which is, I think, is also very important to mention, is the equality of access. So the Beating Cancer Plan puts a very strong emphasis on equality of access to cancer treatment and prevention and early detection and everything. And I think that is crucial, because if you look at the numbers, we see that there are 30 or 40% bigger chances of you surviving cancer if you are born in some Western member state than in an Eastern member state of the EU. And that's something which is completely appalling. That's ridiculous. And we cannot really speak about European Union, about solidarity, about EU citizenship, especially EU social citizenship, if we do not make equality of access a big priority, and if we do not equalize and converge health outcomes across the member states. So quality of healthcare, health standards, access, health outcomes in the end have to be more or less the same in all member states. I think this should be our top priority, and it's very well reflected in the plan. Of course, I won't go into specific details. It's about the HTA regulation is mentioned, clinical trials, etc. So there are some really concrete and great initiatives there. So these were the positive aspects. But I think, and of course, all of this is great. And I said we have this really big added value that is provided by the plan. But I think in some areas, the Beating Cancer Plan should have been more ambitious, I have to say. So the first area, this is something that both Nico and I have been strongly advocating for, but all other MEPs have picked up on that as well, is the joint procurement of expensive medicines. We know that buying medicines, especially for rare diseases, especially where you have small number of patients, are a big financial strain on national healthcare systems. And this is the reason why some of these very expensive drugs are not available in certain parts of Europe. And this is completely inexcusable. Of course, smaller member states with smaller resources, especially in Central and Eastern Europe, have a much weaker bargaining position when conducting negotiations with pharmaceutical companies about pricing of these medicines, and for this reason they have big problems, and the final outcome is a big problem for national healthcare systems, for national health insurance funds and budgets, and that is something that really needs to be addressed. Common procurement on EU level can definitely be used to reduce prices. It provides a much better bargaining position to the European Union as a whole, and it can also result in the end in all member states, all patients having the same access to same medicine. Of course, so a similar procedure as with vaccines. We know that we had some problems with vaccines, but I believe that this will be sorted out very in the next weeks or so. So that was my first point where I think the plan could have gone further. My second point is that more concrete legislative proposals should have been envisaged. One concrete example: right to be forgotten. So right to be forgotten means that after a certain period of time, cancer survivors are not discriminated against. They do not have to pay higher insurance premiums just because they survived cancer. Usually it's 10 years is usually the limit which is considered, but of course it can be sometimes longer, shorter, etc. Some member states already have legislation, 4 member states, Belgium, the Netherlands, Luxembourg, and France, which already prohibits this kind of discrimination. EU has already its own legislation which regulates insurance services, financial services. So we have the competence, we have the best practices already in some member states, and there is no reason for EU not to regulate this by way of secondary legislation, so that all cancer survivors in all member states have the same rights. Because it is very important that cancer survivors in France are not in a better position than cancer survivors in Croatia, Romania, Portugal, Italy, etc. So we have all the possibilities to do that, and unfortunately, the Beating Cancer Plan only provides for a code of conduct which should be jointly made with the industry. And I think this is definitely doesn't go far enough. I think we have a clear legislative competence and possibility to regulate this, to prohibit this kind of discrimination, and I don't see any arguments against it, really. I mean, and I think that no one can say a word against something like this. So I think this is something that definitely we could have gone further. Also, there are some other areas where you do not have a lot of rules, like cross-border healthcare directive. But okay, revision is currently in progress. Our colleagues from DG Sante will be able to say something about this. There is also the new legislative initiative on the use of health data, which I think should be published by Commission by the end of the year. So I think when we take all of this together, in addition to the cancer plan, I think we'll have a very good possibilities and much better situation in terms of beating cancer. And of course, really, and what is also, but as I said, more ambition in certain areas, more binding legislation, more concrete proposals could have been made. But to sum up, this does not diminish the value of the plan. I think it's a good step in the right direction. It's a big progress, big step forward when compared to what we previously had. And I think and I believe that by acting jointly, so the Commission, us in the Parliament, in the committee, special committee on beating cancer that we are all members of, all three of us, that we can really provide concrete legislative solutions, concrete projects, concrete financial initiatives, concrete investments to create better health outcomes, more equal access to cancer treatment, and in the end, to really have a much better situation in terms of fighting cancer in the next 7 years. So thank you very much, and I wish you a nice discussion after this. Thank you.
Thank you, Tomislav. Great to hear your point of view there. I know Francoise Meunier, who's been leading that Right to Be Forgotten campaign, will be very happy to hear your words. And of course, Stella Kyriakidis herself gave a passionate comment during the press conference on the Beating Cancer Plan about the right to be forgotten. So let's hope that we can strengthen the plan a little bit more in that area. Hashtags for those of you tweeting about this event: hashtag EU Cancer Plan and EU40 Talks. They're the hashtags to be using. And don't forget the Q&A button at the bottom of your screen if you want to ask a question or make a comment. Going to go around some of the panel and ask them for one thing that they think is really good about the plan and one thing that they think is missing. We'll come to our friends from DG Santé in a moment, because I think that they will say that the plan is perfect, right? But let's start off with Sarah. Sarah, what do you think?
Yeah, thank you, Mike. I mean, this is a great plan, to be honest. This is a quite comprehensive, ambitious, holistic plan. It's not perfect, but that's what we're here for and to discuss. So first, I would like to just greet my Tomislav and Nico, my colleagues in the Parliament, and all the panelists. And I hope we can have a really, really interesting discussion this morning, because it's with the contributions of everyone that we can improve this plan and make it more tailor suited for the needs of the citizens, of the patients, of everyone here in the EU, in order to deal with this important disease that is cancer, and that translates into a huge burden of disease for the whole of EU. I would say one thing that is missing is, and I have to just give the background that I'm a medical doctor in public health, so I really usually focus a lot on prevention. And one thing that is missing is that we have that 30 to 40% of deaths of cancer can be avoided. So we know the risk factors for those. So, but we have that for oncological diseases, we only know 50% of the risk factors. That means we only know 50% of the external factors beyond the genetics of the individual that can lead for you to develop or increase your risk for you to develop an oncological disease. And one thing missing in this plan, I know there's a focus on research, but that is through all the life course of the disease. And one thing that is missing is a strong focus on research for epidemiological cohort studies. And these cohort studies, such as the one that happened with the Framingham study in the US in the last century, that allowed for us to ascertain the different risk factors for cardiovascular disorders, among others, is long in time. It's quite a financial burden, so it's not something that it's very trendy for us to invest, because we're not going to have results in 5-10 years. We're going to have results more on the long term, but it will give us the tools for us to establish causality, because we cannot establish causality only with biological plausibility, so only doing experimental studies or clinical trials. We need to know and follow a large sample of the population, follow it through time, and see, according to the different exposures, which ones had higher risk of developing different types of cancer. And that's one thing that I think this plan should focus on, because it's a great opportunity. We have the EU, around 500 million citizens, 27 different member states with different exposures, cultural exposures, and it would be quite important to forecast such a network. But above all, that's my greatest input for the plan that I see missing, that I think we could work together to make it happen and actually reach 2030, 2040 with greatest evidence on what is causing cancer in the individual beyond the genetics.
Great, thank you, Sarah. Niku, what do you think?
Good morning, everyone. I'm very happy to be here with all of you. I guess if Tomislav is our D'Artagnan, then Sarah would be our Athos. I should be Porthos. There should be Aramis, and Aramis, I think, is EU40. And that makes all of us health musketeers. I'm very happy to discuss this cancer plan, because I believe that after the pandemic, this can be the main breakthrough of the European Commission in its mandate of 2019-2024. And what a beautiful story that would be, that we finally have a Europe of health, something that nobody imagined for many decades in this continent, to be honest. Of course, it took a pandemic for us to open our eyes to the wider health problems of the Union, but it also opened our eyes to a simple reality. The European citizen does not study the treaty and knows in great detail if this is a member state job or it's a Commission job. The citizen just looks at the Union with or without competence, and it expects the Union to do something. So the fact that we finally have a cancer plan and a cancer strategy and a BECA committee and all this, and a budget for it, this is very important. I think these are great breakthroughs. I like the plan, but I do not like certain things, or I wish I see more of certain things. And I will tell you what. I find that the network linking national comprehensive cancer centers to be established by 2025, this is great. But we have to admit that some of the national comprehensive cancer centers are comprehensive and excellent only in name, because they lack equipment, they lack essential medicine, and they lack many other things. And I think one part of the plan should have been the use of structural funds, for instance, to develop those capacities. I try to take from my own experience. I was posted in Ethiopia for a part of my career, and there China had built the main building in the town, which is the headquarters of African Union. Now the operational costs of that building were paid by the EU, but guess what? Everybody on the street saw that China built that building and said, what a great gift the great nation of China did to us. and whereas the EU was paying much more money. So we have to not forget the value of the symbol, you know? People think very easily, and if we manage to build one hospital in every single member state that is an excellent and well-developed oncological center, I think that already would be a great win for the European Union, and it would win hearts and minds. Now, I know that the Commissioner said we are not in the business of building buildings, hospitals, but I disagree with her on this profoundly. I think through the use of the resilience funds and all this, we could establish the goal that at least one such centers exists in each member state. There's many of the actions that are simply excellent. I like the ideas on the screening, on the vaccination of girls by 2030. I like all this. It's a good plan. Let me not be seen as opposing it in any way, but I just wanted to see more. And I would like to see more on the schism, on the difference between East and West, because some of us speak of an iron curtain there, and I only see here in terms of actions that we will create an inequalities registry. I would like to see more than just a registry, because the data and the facts are known. We had an excellent presentation in the Becker committee just two weeks ago, and everybody knows that these realities are harsh and unfair in the European Union. So we need to do more than just a registry. We need to do more on equal access to new and innovative medicine. And I totally agree with Tom Mislav. It was something I kept saying, joint procurement, the idea that came from this crisis could be perhaps established also here. So let's kick off the debate by being a bit more provocative.
Thanks, Nicu. Very interesting. Let's ask Antonella Cardone, the director of the European Cancer Patient Coalition. Antonella?
Yes, thank you, Mike, and thank you, U40, and all the MEPs and the representative of the European Commission here to host this interesting debate. So at the European Cancer Patient Coalition, which is the largest EU umbrella cancer patient organization, we are pleased to see that the fight against cancer remains a top priority for the European Commission, despite the health crisis due to the coronavirus. And that the EC, the European Commission, is committed to revert the trend of cancer becoming the first leading cause of death in Europe by 2035 if we do not act immediately. So nevertheless, despite seeing that Europe is on the right direction in order to end the rising burden of cancer, effective implementation of the plan is key to us. And we are committed to support the execution of the plan. As it has been said by the MEP Serdas, we are all here together, and only together we can win the battle against the cancer. So the European, so ECPC, I mean, we have joined forces with the ECO and the FPA to propose a European cancer dashboard to support the implementation of the plan. So the principles that we presented have potential to uplift the plan and to monitor its success. However, whether Europe's Beating Cancer plan will achieve its goals or not is a million-dollar question. The plan is a unique opportunity to tackle the current rise in mortality rates and late diagnosis. It is also an opportunity to ensure that patients have the best treatment wherever they were born or live, and have the best quality of life possible. So we welcome the holistic approach of the new cancer plan and the comprehensiveness of the plan that tackles the entire disease pathway from cancer prevention. And so we really welcome all the initiatives and the mentions in the cancer plan on tobacco control and early detection to treatment and survivorship. And we also welcome that the plan addresses the debilitating cancer complications and comorbidities that have an impact on the overall survival rate and on the quality of life of cancer patients. Because this is still a too often neglected in policy and research topic. So there is a lack of collective knowledge on cancer complications and comorbidities. Therefore, we welcome the creation of a knowledge center on cancer. So to battle the existing inequalities, the National Comprehensive Cancer Centers, the European reference networks, and inter-speciality training programs for oncology, surgery, and radiotherapy are promising steps towards a more effective diagnosis and to strengthen and expand the multidisciplinary workforce in all EU countries. So ECPC expects to see a creation of a specific reference network addressing cancer-related complications and comorbidities. So having said that, at ECPC we also stress the lack of ambition in promoting the EU values of solidarity, equality, social inclusion and well-being of citizens. Some priorities were identified in the Europe's Beating Cancer Plan roadmap and the need to be tackled. We believe that the best solution in order to facilitate access to financial services for cancer survivors would be the recognition of the right to be forgotten for cancer survivors in all member states. Some solutions facilitating access to financial services are considered, but the Commission does not promote a legal framework coherent and consistent with the consumers' rights and EU treaties. So I'll stop here, and I'm sure that some other topics will come up as we go along with the discussion. So thank you.
Sure, thanks, Antonella. And I think you rightly pointing out the importance of measurement of the plan's success. Niku made the point about the inequalities registry, and of course we want to do something about it. We want to make sure that the inequalities are reduced by virtue of this plan, and through the inequalities registry and other measures that we can introduce, we can make sure that that happens. So thanks for emphasizing that, Antonella. There's a couple of interesting questions in the chat if the panel want to have a look at those. Emil is talking there about alcohol-related cancers, and we have Tanya, a family physician, talking about some of the issues there in Southeast Europe, talking about the inequalities issue that we were just raising. So if the panel can have a look at those questions in the chat, and if you're watching, feel free to add more questions, that would be great. Let's go over to Split and join Edward. Edward, are you there? You're on mute, mate.
Let me just unmute myself.
There you go.
And, say that I'm honored and I'm having a pleasure to be with you and listening your discussion points with a pleasure again. And thank you all for putting cancer, the real European problem, the everlasting pandemic of ours, in the spotlight. In the name of all professionals that are giving their best in everyday business as well as our patients. You realize that in Europe, we are having 1/10 of world population and double more deaths. So from the cancer point of view, Europe is underserved. So from the point of view of plan, it's better to have any plan than no plan at all. So just to remind you that President Nixon in US declared 3 wars, one against the drugs, second against Vietnam that he lost. But the third one was against the cancer in 1971 when they came up with their plan. So we are in delay for half a century. So better ever than never, okay? So the plan is nicely written, clear, comprehensive, covering all areas and problems. This is my point of view of the plan. But as far as what is not covered, it is not clear, there are not clear defined goals and processes of monitoring and reporting of plan implementation. The name of the game is how to implement the nicely stated goals or problems that are covered in the plan. So also what I'm not seeing in the plan is coordination with existing national cancer control plans of the member states. So all member states do have their plans. How to coordinate that EU beating cancer plan with the national plans of the different states. Another example of the problem is legislative for precision of oncology. So there are many statements within the plan about our goal to implement precision oncology. We have to have legislation for that process. We have to implement so-called molecular tumor boards, not only multidisciplinary teams, but something that is going to give us a way to implement that precision oncology, ethical legislation processes for early access to the drugs that are going to cover the needs for our patients for mutations that we are going to discover with the comprehensive genomical analysis. Recently, Mike, we published an article in European Journal of Health Economics covering we tried to calculate the cost of implementation of all 284 measures that we proposed in Croatian National Cancer Control Plan, that we calculated to spend 200 million euros in 10 years of time. And we came up with 111,000 lives years saved with those measures to be implemented. And we came up with a quality of just less than 1,500 euros. So the message of ours is with proper implementation of investment in infrastructure in oncology is going to be returned on such way that were not seen before in medicine. So what we need to do is to implement plan 100%, and there is an 11th chapter just mentioning that will be kind of board that will measure. So what I'm saying here, that monitoring and reporting and infrastructure and digitalization and to be naked in front of everybody about our outcomes is the key for success. And this is from me at the beginning.
Well said, Eduard. And of course, a lot of comments here from the panel about the importance of implementation to try and make sure that we don't leave this plan sitting on the shelf gathering dust. The next few weeks and months will be essential in the Special Committee on Beating Cancer, in particular, that we hope will be extend its remit for a few more months so that they have the time to review everything. And Niku was mentioning earlier about Professor Mark Lawler's presentation, and I know Mark has worked closely with you, Eduard, on the issue of inequalities, and I think that's something that we will be focusing on in the coming weeks and months with the special committee. So that's great. And of course, this is all about patients. We heard from Antonella. Let's hear from Ivica about your view, Ivica, on the good things and the bad things in the plan.
Yes, well, thank you all for the invitation, and it's really an honor to be here today. I agree with Professor Rudaljak. It's a very nicely written plan, and I especially liked the part of taking care of cancer patients, cancer survivors, but also their carers and family members who are actually also affected with the burden of cancer. And the quality of life and life after cancer, life with cancer, this is something that it's not always mentioned. So this is for me the greatest value of the plan. But I would also say that what I feel that is lacking in the plan is the mechanisms how we will really ensure the equal and equitable access to healthcare and cancer care for all EU citizens, and not to create even deeper gap than it already exists with countries with higher income and other countries in EU, and in countries where they have better infrastructure, better cancer registries, that will they can build up on that. And what's about the countries that don't have this infrastructure? How will we actually equalize the conditions in EU member states? So this is something that I lack in this cancer plan. Thank you.
Thanks, Ivica. And I know, Sarah, you played a big role in the launch of the European Code Against Cancer on the patient rights issue, the 10 patient rights. I know you were very interested in the shared decision-making side of things. What do you think the message from the EU Parliament to cancer patients going through that terrible journey from diagnosis through to treatment and beyond? What do you think this plan can really deliver for them?
Yeah, so when dealing with an oncology disease, you are facing a multidisciplinary team treating you as a patient. Sometimes it's really hard to translate the language health professionals use. This is one of the barriers. Another barrier, and one thing that we should work together, is to make the patient at the center of the decision-making process, whilst informing him and him being informed of all the availabilities and options ahead of him and the consequences of it, and understanding them. This is important because as health professionals, sometimes it's a very hectic life. We understand it's sometimes hard to explain. Sometimes we need more than just one session to explain what's really happening, because we're talking about very, very technical concepts in a very trying to simplify very technical concepts. And this is quite of the utmost importance, as I believe the patients should be at the center and should have the right to be informed and involved in the decision that will be taken. So usually there's these multidisciplinary teams asserting what are the options for the patient, and the patient should be involved in this part. And this is something that we can actually put in regards to sharing best practices among member states. So this is one of the examples that this plan will open the door for this to become a reality in the whole of the EU.
Thanks, Sarah. And it was very interesting at the at Stella Kyriakidis' hearing with the special committee last week, that she focused on the European Code of Cancer Practice and how to implement that across Europe. Those patient rights we see as very important for the reasons that Ivica just said. And of course, in the plan, the other code, the European Code Against Cancer, is going to be updated, and our friends at ECL coordinate that, which is another great initiative within the plan. I wanted to come to our friends from DG Santé next. Caroline, I know you're very much involved in the prevention aspect, tobacco in particular. What do you think about the initiatives in the plan and how they're going to actually be implemented?
I think tobacco is me.
Oh, sorry.
Caroline, yeah, Tia Emmerling from DG Santé.
Go ahead, Tia.
Yeah, let me just give a little outline of what we are doing in prevention, because we are seeing that 40% of cancers can be prevented. That's the most cost-effective measure that we can take. And the leading cause of cancer here is tobacco use. So we know that 27% of cancers are preventable if we really, really tackle tobacco use. It's 1 out of 4 cancers preventable, can be avoided. From lung cancers, one of the most common cancers, one of the most lethal ones, we can avoid 90% of these cancers by having a strong tobacco control policy. Tobacco control was already a part of the first Cancer Action Plan. We have continued with this work, and we are very happy that we could renew the ambition in this second Cancer Action Plan. We are aiming at achieving a tobacco-free generation by 2040. We define this objective by bringing down the tobacco use rates from now around 25% to 5% in 2040. This is an ambitious target. It is a doable target, because it will mean to bring down the tobacco use rates by about 1 percentage point per year because we talk of a 20 years time span. So this is doable. We need to continue to focus on the young generation, because we know that more than half of the people who get addicted to tobacco and related products, they get addicted before the age of 18. So there we have a big potential to save lives. The objective is also not so ambitious that it wouldn't already exist. Some of our member states have this or similar objectives, but the fact that that is becoming an EU objective, that is really new. Now, what are we suggesting to do? And before I elaborate a little bit on that, I would like to stress that tobacco control activities are never one activity alone that brings the result, and they are never one actor alone. But we need joint efforts from the EU level. Also, your support is really needed, and joint efforts also with the member states. And the first thing we can do is to really go towards a rigorous enforcement of the existing legislation. We can start that tomorrow, and that is mainly addressed to member states here. At the EU level, we are looking at the legal framework, how it can be strengthened, and the plan outlines a revision of the Tobacco Taxation Directive. We know in tobacco control, this is tackling tobacco taxes is the most effective tobacco control instrument that we have in our hands. So that will be one of the first things we are going to do. We are also looking at the legal framework around cross-border purchases. We have the Tobacco Products Directive, which bundles several tobacco control activities that in order to, it will, if we strengthen it, it will help us to achieve the target of a tobacco-free generation. We want to tackle tobacco advertising, promotion and sponsorship, especially on the internet and social media, which are mostly used by young people and young adults. We will update the Smoke-Free Environments Council recommendation. It was drafted in a time where we mostly had smoking products, and now we have new market developments, new products that we want to tackle and address. And we are going for a better implementation also of the Framework Convention on Tobacco Control, because nothing what we do is new. The frame of everything that we can do is very nicely outlined in the FCTC. And that is a treaty that applies to the EU and also to its member states. And here also member states can do a lot, for example, by looking at sales to minors, by improving and setting up smoking cessation campaigns. We know these are very effective tools. The cancer plan is supposed to stimulate these activities at EU and at member states level. And I've said at the beginning, tobacco control is a joint effort. And I would like to say that the European Parliament has always been a strong supporter of health activities at EU level. It has been a strong supporter of the Cancer Action Plan, and the feedback, the interventions we had this morning. So I'm very delighted to hear them, that there is this strong support. But it had also always been a strong supporter of tobacco control actions. And when we go through the implementation of this plan, we really need your support when we revise the legislative provisions. And therefore, my plea to you, please continue to support strong tobacco control actions also at EU level, so that we jointly work towards a tobacco-free generation. Thank you.
Thanks, Taya, very powerful. And that headline, tobacco-free generation, I think that really is aspirational and ambitious. I think the numbers in the plan are really strong. Of course, the prevention pillar is probably arguably the strongest pillar in the Beating Cancer Plan, and of course brings other public health benefits, not only for for cancer, but for all other diseases in cardiovascular, for example. So that's really strong. Taya, I don't know whether you saw the press conference where Stella Kyriakides, the Health Commissioner, presented the plan. It's very interesting, the number of questions from journalists about tobacco and about alcohol. And I guess a controversial sort of, from a journalistic perspective, aspect of the plan is to what extent are we trying to control people's lives and stop people making their own choices about how they live. How have you been able to, in Santé, when you've been looking at tobacco, how have you been able to address that in your thinking?
So we are looking at risk factors here. We are looking at what individual citizens can do for their own health, but also for the society. So both of these actions are really actions that touch upon the lives and the behavior of individual citizens.
Yeah.
And this is why they are difficult. In tobacco control, we are talking about an addiction. So this is not just changing behavior, but it is getting rid of an addiction. So this is not so easy. And I really have a lot of respect for everybody who managed to quit smoking. And a lot of people managed to quit smoking. So we also have success stories. We have a success story that we have brought down since the first Cancer Action Plan to now. We have brought down smoking rates and tobacco use rates. So we were already successful. We just need to continue on this path and step up efforts, because the 40% target it's to one extent aspirational, but as I've said, it's doable. It means 1 percentage point per year. This is a doable ambition.
Well said, Taya. And I think the plan, the prevention pillar of the plan is very strong, as I said earlier. Niku was mentioning earlier the part of the plan, the flagship policy on HPV elimination and vaccination of boys and girls. All of these measures, tobacco is another one, all these measures in prevention are very strong, and as I say, hopefully will benefit public health in more ways than cancer. Caroline, coming to you you're an expert in the cross-border in DG Santé, and I'm just thinking about what Tomislav was saying about the plan and his introduction. What's your view on how the plan can develop cross-border work in healthcare?
Okay, thank you very much and good morning, everyone. Yes, I think an important point that was mentioned by several of you is that there is still huge unequal access to healthcare across Europe, both within member states and between member states. And as Tomislav Sokol said, this is totally and utterly unacceptable. With regards to cross-border healthcare, then, most patients clearly would prefer to have healthcare close to home, close to their friends and family. And I think for a serious medical condition such as cancers, this is really more important than ever. However, cross-border healthcare can offer a lifeline to patients where the most appropriate treatment or the nearest hospital is across the border. And just to explain, the way this is usually done is that a patient can seek this access with prior approval from their health insurer, and then go abroad and then have the cost for that treatment reimbursed by the health insurance provider. Now, this takes place under the Social Security coordination regulations, and this is usually the case if you're talking about cancers. However, for the last 10 years, we've also had an EU law, a directive on patient rights in cross-border healthcare. And this directive also offers access to patients for healthcare in other member states. However, patients have to pay for the cost of this healthcare upfront. So in that case, it's quite difficult, as you can imagine, for patients to access the healthcare in this way for cancer. Nonetheless, patients could use the directive to seek a second opinion from cancer specialists, and this can be done without prior approval. So I just thought I'd clarify the situation with regards to cross-border healthcare. What we are now doing is assessing how this directive is working in practice, and we're launching a big public consultation in May, which will last for 3 months. And I'd really like to use this opportunity to say, you know, we are really inviting views from everyone to know what could be done to improve the patient rights set out in this directive in practice, how it's working in practice. And we really depend on this feedback in order to see how this could be developed in the future. A final point I just wanted to make was regards to the comprehensive cancer centers, which were mentioned. This, of course, is going to be a cross-border collaborative effort to ensure the patient gets access to diagnosis and treatment closer to home. And indeed, it will build on existing infrastructures, as already was mentioned. What will also be important is that these comprehensive cancer centers are linked with the already existing European reference networks in rare diseases. You have 4 European reference networks that are already doing great work for many patients who have rare diseases, although they're virtual networks, I have to add. So this takes place via virtual panel discussions with specialists across Europe. But I thought it was important to add the importance of these European reference networks to the discussion we're having this morning. Thank you.
Thanks, Caroline. Of course, the expansion of European reference networks in the plan is an interesting feature.
Yes, indeed.
Niku, there seems to be some consensus in the room so far that there's a lot of good stuff in the plan, that it's ambitious, that we all want to support it, but there are gaps. And I know you work closely with the rapporteur of the Special Committee on Beating Cancer, Veronique Trillet-Menoir. How do you see these next few weeks and months going in terms of how do you see the gaps that have been identified in the plan by you and by other colleagues? How do you see the Special Committee playing a role in changing that? And also, how closely do you work with the other political parties and groupings on this plan? Is it a political football, or do you work more collaboratively than usual?
The good news is that health is probably one of the sectors where I've seen most collaboration in political terms, and not so much political point winning. Now, it is politics, so anything can happen, but especially in the Cancer Committee, I've seen an across the board common understanding that this is a fight we can only win together. So I see unity. Tomislav, Sarah, Peter Liese, Veronique Trillet-Menoir, myself, and many other leaders are a little family. In a way, we always meet, in the plenary, in the committee, in the BECA committee, always being on the same side of the debate, I would say. So I see a great opportunity. Now to your question, the BECA committee has already decided an extension of its mandate, initially by 3 months, but this can be even longer. And that the point of this was in order to be able to give feedback to the proposals that are going to come this year, whereas at the same time not losing our political punch. Because if we draw too long on the existence of the committee, we might actually lose the fight to other committees who will be involved with the particular legislation, because the right to be forgotten will go I would assume in several committees, including perhaps economic or LIBE, the personal liberties and things like that. So I would see here an important role for us in improving the plan, and I hope the Commission is open to this. It is already an excellent plan, but we do see a couple of things where it could be even better. And we look forward to getting legislation already ongoing.
That's refreshing to hear, Niku. And let me ask Tomislav for his final thoughts on the discussion that we've had today.
Thank you very much. I will also use this opportunity maybe to answer some of the questions from the Q&A that I saw. So I will first do that, and I will try to then to maybe close. One of the questions was about primary care, and this is something that really wasn't touched upon in that great of a detail by any of us, but I think that is very important, because primary care they should act as gatekeepers, and they should be kind of the first point of contact between the patient and the system. And it's very important that primary care providers are educated enough so that they know what to do, in what times they have to order additional checkup or send the patient to a specialist and things like that. This is something that can also be better addressed, I think, in the plan, also, especially in terms of maybe providing EU funds for more education of primary care providers, because there are big differences across the member states in relation to this. So I think that's a very good point from the audience. There was also a question about alcohol warnings. And so the warnings about alcohol contact and consequences, etc. So that is also provided in the plan. It's part of the whole thing about prevention that was already mentioned by Thea, but that's probably the most, I would say, contentious part of the plan. And I think the most discussions and most opposing views will be about this. So because as Mike, you mentioned, this is about people's way of life, and they don't want somebody to force something upon them. But it's also about harm reduction. So the plan has a pretty negative view on the things like e-cigarettes, etc. It is based on science, definitely, and the European Court of Justice also supports this view. But I personally believe that maybe we should invest more into research about this, to have more clearer data, also whether this kind of measures can help in some instances where there is no other better way. So if somebody just cannot stop smoking, whether it's better to reduce harm by this than not have anything. So this is something that will be debated a lot about. But what I personally think is definitely we need more research, more data about this. There is also mention in the Q&A about whether member states can introduce extra measures. Definitely yes. So EU does not have the power to unify, to tell member states everything they have to do. So EU, I think, here is to set this kind of a minimum to help member states, but financially, also through legislation, etc. But if member states want to do more, want to invest more, want to have additional measures in terms of prevention, in terms of cancer registries, etc., they can. So this is not. And this also relates to what Professor Budolak mentioned: the national plans. So national plans should be complementary to the EU plan. So EU plan is here. It sets some common rules which will be jointly pressed by the EU. But of course, member states can provide additional measures, additional actions within their national plans, taking into account, of course, national specificities. Because in some member states, obviously, there are some priorities, and in other cases, there are other priorities. Maybe in some member states, prevention and early screening is more developed than in other member states. So in this sense, the financing priorities and in terms of action, etc., is something that member states will have an autonomy to decide by themselves as well. So this was something. These were answers to some questions that I picked up on Q&A, and I'll just try to sum up most important things that were mentioned. But I think kind of that was kind of encompassed in most of the talks. So first, we need more data generally. So data. So Sarah mentioned research on risk factors. Professor Dolak mentioned provide clear benchmarks, measurements, etc. So this is first point. So we need more data, we need more information, we need more research into this. And one thing that we didn't mention, which is also important, is that I'm very glad that in the new Horizon, one of the priority missions will also be a research on cancer. I think that is very important because it gives us possibility to invest much more resources into EU money into research on cancer than before. So more data, more measurements, more clear benchmarks, definitely. Second is about implementation. Implementation obviously is crucial. And I agree that we have goals, but there are also differences. In some areas, we have very clearly set goals, like for instance, the number of people we want to vaccinate for HPV, for instance. while in other areas not. So there are really differences. So in some areas you have clear benchmarks, clear goals, clear measures, clear implementation activities, clear deadlines, which is always obviously important, clear funding, and in some areas not. So what I think personally, and this is something that I will advocate within the committee, is that in addition to this plan, we have maybe a clearer and more detailed action plan related to each part of the plan with much more specificities. Because because having an action plan, so having more clear deadlines and benchmarks and measures, I think that's something that will really help that we see how this plan will be implemented. And three, money, obviously. We always need more money. And I think that if we want to reduce inequalities in healthcare, 4 billion euros is not enough. This is why I mentioned in the beginning. 4 billion euros for me, I understand it as direct investments into concrete measures that are specifically mentioned in the plan. Early, for instance, HPV vaccination, early prevention programs, so screening, things like that. But in addition to this, we have this whole set of problem with infrastructure, lack of infrastructure, lack of equipment, especially in some member states, which is something where I think we should go much further than is mentioned than these 4 billion euros.
Sure.
I did some research myself in the previous 7-year budget of the EU. The biggest source of investments into healthcare was cohesion policy. It was more than 10 billion euros. And this was invested mostly into infrastructure, but not just infrastructure. For instance, in Croatia, European Social Fund was used to finance a lot of specializations, which is a big problem when you have an outflow of workforce. You have a lot of doctors and nurses going to work in Germany, the Netherlands, France, etc. Then you have to you need more of them. You need more specializations. You need more students of medicine, etc. And a lot of these specializations was financed from European Social Fund. So this is also one source of funding that can be used also, which is not about specific measures related to cancer, but it has a great impact. So these are my three main points.
Right.
So more data, better clear benchmarks on implementation, and more money that is provided here, but also to look at this in a more general way, and also to use all of the EU policies that we have, as I mentioned, cohesion, horizon, research, investment, everything. So everything should be used to tackle and beat cancer. So not just the measures that are explicitly mentioned in the plan. And I think this is very important. And again, I want to thank all of you for a very nice and very in-depth discussion.
Thanks very much, Tomislav. Some great points and some great questions in the chat there that you answered. I liked Kathy Oliver's question about health literacy as well. So thank you to all of our guests. We really appreciate your time and your expertise and your feedback on the plan. We learned that the EU Commission is working on an implementation roadmap for the plan. Matthias Schuper, who leads the team there, has just been talking about that. So that will be interesting to see that implementation roadmap. We'd like to thank Sarah, Tomislav, Niku, and all of our panel for their time, and all of you for watching. Thanks for being with us.